Well, less than a month remains in this year's Illinois legislative session. Governor J.B. Pritzker's proposed Health Care Protection Act remains on the agenda. Illinois Capitol Bureau Chief Max Cotton explains.
For far too long, insurance companies, not doctors, have determined what treatment options patients should have and how quickly they can receive it. This bill puts power back in the hands of patients and their doctors.
In a bipartisan vote, the Illinois House of Representatives passed the Health Care Protection Act last week. It now heads to the state Senate. The bill does several things, including regulating some common utilization management practices.
Utilization management comes in many forms, but it's seen most prominently in prior authorizations and step therapy.
Prior authorization is when the insurance company has to sign off before you are admitted to the hospital or receive treatment recommended by your doctor. The bill would ban the practice for inpatient mental health services for the first 72 hours after someone is admitted, making Illinois the first in the nation to do so. Insurers would also have to publicly post all treatments requiring prior authorization. Step therapy is when the insurance company requires you to try and fail on a cheaper drug before it will cover the meds your doctor thinks you need. The bill would also ban that practice in Illinois.
We're protecting consumers even further by prohibiting the sale of junk insurance plans, which don't even meet the minimum standards of the Affordable Care Act.
The bill would also improve network adequacy standards by requiring insurers regularly update which doctors and hospitals are in network. It would also ban so-called unreasonable rate increases for large group insurance carriers. The state already bans it for individual and small group policies.
This is about protecting Illinois families, making it easier and a little less labyrinthian to navigate the world of healthcare and insurance.
In Springfield, Max Cotton, WGEM News.